Oh, yeah. How you doing? Thanks a lot for being with us again. They are definitely, without a doubt, lying to us. Little too strong, you think, maybe? Maybe some of you think that's true. I'm going to cover 6 reasons why there is no way you can trust the mainstream media, but in particular, even these public health officials. Let's get into it right now. Hi, I'm Jonathan Landsman, your host for Natural Health 365 Live. We do these shows every single day, Monday to Friday at 12 noon Eastern Time. Every one of these shows is designed to help you improve your immune system function that will automatically protect your health. That is our singular focus here at Natural Health 365 with these live broadcasts. Hey, if you're new to this show, please do me a big favor and just type new in the comments section, because I definitely like to say big hello to all our new people out there. And hey, even if you've been watching us for a while now, please do me a favor. You know the drill. Share this show with someone you feel needs to hear this kind of message, because it is just too few and far between. The more I do this research, the more I see that there are just so many people that don't get this kind of real information. Okay, so why would I say they are lying to us? Sounds so strong, right? Dramatic, like I'm just trying to get some attention, right? I'll let you decide, all right? Let's look at number 1. What are we talking about, first of all? The topic is what's affecting all of us. This virus, this thing they're calling a pandemic. All over the world, everyone has been affected. Emotionally, mentally, physically, economically, on every single level, this is touching so many people's lives. But let's look at some of these things here, and you tell me if you think they're lying to you or not. Back in 2005, here in the United States at the National Institutes of Health, the NIH, they published a paper that was actually out of the Virology Journal that said, okay, and these were researchers that were linked to the United States Centers for Disease Control and Prevention, the CDC. You ready for what they said? And I quote, back in 2005, right? Hello, are you listening? I hope my camera guy's listening too. We report that chloroquine has strong antiviral effects on SARS-CoV infection. End quote. 15 years ago. Are you ready for the lie? In May of 2020, I laugh, but it's not a joke. This is how crazy this is. All you got to do is a little research like me, and you see this is real. Dr. Good old Anthony Fauci says it's not effective. Chloroquine is not effective when it comes to this virus. Lie. Let's look at number 2. Moving right along here. Hydroxychloroquine. No, I didn't mispronounce. Chloroquine is one. Hydroxychloroquine is another. It's another element related to each other, close, but not the same. There was a study that was published in July of 2020. This year, this month, folks. Hello. In the International Journal of Infectious Diseases, with over 2,500 patients hospitalized with COVID-19 at 6 hospitals in the Henry Ford Health Center between March and May of 2020. Okay? You ready what the researchers concluded? You know I like to say hello. Please stay awake. Don't fall asleep on this one. Quote, the use of hydroxychloroquine alone and in combination with azithromycin, right, the Z-Pack, the antibiotic pack, was associated with a significant reduction in hospital mortality compared to not receiving hydroxychloroquine. Are you ready for the lie? Who could possibly be lying to us? I know you're ready. Good old Dr. Anthony Fauci, who says it is not effective. These are quotes, folks. All you have to do is put the 2 and 2 together, and you will get 4. You know what I mean. Let's look at number 3, vitamin C. Now, look, we've talked about vitamin C. This is clearly out in the research. Why would anyone have any doubts about this? Over in China, even though we know that the virus came out of there, it spread throughout the world. But what did the Chinese doctors do when their people were suffering? They used vitamin C. I've spoken to one of these Americans here in the United States who actually was still is, in Shanghai, China at the time when I interviewed him, Dr. Richard Chang, okay? He knew exactly what was going on. He had a lot of colleagues embedded in Chinese medicine, the traditional medicine that's performed over there in China. He was in Shanghai at the time talking directly to these doctors, and they were using vitamin C at a level of 12,000 to 24,000 milligrams a day, IV, with these patients. But yet here in the United States, we use nothing close to that in just a small amount, and they were finding great success in helping their patients by giving them vitamin C. You and I both know why that is not popular here in the United States. Can you say Big Pharma? That is exactly why it's being kept from you, and it's not being talked about in the mainstream media at all. In fact, I would venture to say if there's any reporter out there that would like to run a very detailed report on it, most likely your editor is going to say, move along and pick another subject. Number 4, vitamin D. This is an immune modulator hormone, right? It's said in many NIH studies, okay? COVID patients who are at risk, ready? All of these COVID patients, we know they're victims of the cytokine storm syndrome. If it gets really out of control, if somebody diagnosed with COVID-19 gets really infected, feeling really sick, and gets into the hospital and their lungs get really polluted, this cytokine storm syndrome is what's really life-threatening. The massive amount of inflammation and the damage that it does, the acute respiratory distress syndrome that can set in on some of these late-stage COVID-19 patients. But at the same time, we know from looking at studies at the NIH that low vitamin D levels increase your risk for this happening. So right now, if your levels are low in D, which is very simple to evaluate with a simple blood test that's very inexpensive. You know, we talk so much about testing in this country for CV, right, for the coronavirus. Why aren't we testing everybody for their vitamin D levels? A vast majority of Americans are so low in D. And we know from these NIH studies that what's best, what's optimal, even though they're very low, most people are 20, below 30 nanograms per milliliter of blood, okay? And a lot of them are 20 and even lower. Those are the ones who are really at risk. We know that the levels should be between 40 and 60 nanograms per milliliter of blood. And that's a simple blood test that can be done. The amounts to supplement for D, if you're really low, are somewhere in the area of 5 to 10,000 international units a day. Yes, of course, you should work with an integrative medical doctor. We get it. You get it. But why isn't this information getting out? They lie to you over and over again that there's nothing except cover your face, stay indoors, stay far away from people, and wait for a shot. They lie to you when they give you the impression every day in the media and when you listen to all these public health officials that get on TV that there's nothing else that is quote-unquote approved yet. When we know about these antiviral, antibacterial substances. Now, number 5, this is certainly clearly grounded in the scientific literature, zinc. It is in NIH studies, and it was reported in July of 2019. Ready for this quote? Zinc status is a critical factor that can influence antiviral immunity. The goal is so simple and it's so inexpensive. 20 to 30 milligrams per day of zinc. So important. Why aren't we getting this information out to more people? It's being suppressed, people. And when these top officials are asked directly ever anything close to any of these topics, they'll tell you the same thing. Oh, there's no studies. Oh, it's not effective. They lie to the American public and to the world for that matter. Number 6, glutathione therapy. I did a whole podcast on how glutathione helped somebody out and many others after this one case. It was discovered by a pre-med student who thankfully spoke to a lot of his medical doctor teachers in medical school, and this was given to him as a very viable option when someone is being threatened with a cytokine storm, this massive infection that can do a lot of destruction inside the body, especially to lung tissue, when you're really infected and inflamed. He was told simply to take enough glutathione. Give it to your mother. And that's exactly the story that I told in the podcast, the Natural Health 365 podcast. So this was published success that was put in the NIH, right? A published study that they put out, Dr. Richard Horowitz and James Bruzzese, who's a second-year medical student. They talked about this success. It was repeated over and over again with others as well. As little as 2,000 milligrams of glutathione one time had a major impact, positive impact on making someone feel better, breathing easier, having better energy, knocking down that infectious load. Why isn't this front page news? Gee, I wonder why. And now, this morning, I'm putting together this show, and the last thing I want to bring up to you, it's a really quick show today, but this is a very interesting new solution for coronavirus, and I'm going to have this medical doctor on my podcast, God willing. I've already reached out and spoken to him personally on the phone. Dr. Richard Bartlett, who's using an asthma medication with a 100% success rate. Now, in context, these are people not in the hospital, people who don't feel well and are infected. This is with a medication that is very inexpensive compared to remdesivir, which is, I don't know, something north of $3,000 to take, plus your stay in the hospital, plus the advanced state that you have to be in to get this drug. You're looking at, I don't know, hospitalization, $10,000, $15,000 cost, $3,000 plus for remdesivir. You're looking at $18,000 to $21,000 easily. This is a couple $100s for this asthma medication that's been around for over 20 years, He's also used some basic antibiotics just to kind of mop up any possible collateral damage. Really common sense, basic conventional medicine approach, but again, very inexpensive. He jumps on these situations quickly. He also does include zinc, which is what a lot of these medical doctors have been using. They've used zinc with hydroxychloroquine and azithromycin. So we see this common theme of zinc being put in because zinc is such a strong antiviral substance. But no, Big Pharma can't patent zinc and make billions of dollars. So the mainstream media simply doesn't report on it. You're certainly not going to hear it from Big Pharma salespeople. And the medical doctors are not even going to be hearing about this as well, because they're not even touting it in journals or anywhere else around where they can see. So the key point here, and I want to make this very important point, is the whole thing with Western medicine is screwed up. Take, for example, you get a viral infection and you have a scratchy throat and you're feeling run down. Now you're running a little bit of a fever and you're feeling kind of lousy. You run yourself into the hospital. You're kind of functional. You drove there. You can speak clearly. Your mind is all right. You're not really displaying much of any other symptoms. You get tested, you're positive, but you say you really want to go home and you just want to know what else could be done. In so many cases, Western medicine in general, with a lot of the things that I just painted for you, these kind of scenarios, will tell you go home. Take this drug, take that drug. Don't worry too much about it. Rest. Some basic general advice. But they'll always end with a very standard comment to the effect of, if you get worse, come see me right away. Do you see what's twisted about that? Western medicine is waiting for you to get very, very ill, and then they'll try to throw things at you. The things they throw at you can make your system so stressed out and even sicker just by the treatments that you're going to receive. Now you're going down the toilet even faster, and they throw even more things at you that are more stressful. And in so many cases, there are many, I'm not exaggerating, to the tune of hundreds of thousands of people dying from medically induced deaths. People with good intentions, all the doctors that follow standard operating procedures, standard protocols in a hospital, doing one thing after the other to people very ineffectively and stressing them out, is actually making situations worse and worse. Like the stories you hear of people being put on ventilators and being intubated, and it's blowing out their lungs. And for an infection that really needs antivirals a lot sooner. This is the key point. A doctor like Dr. Richard Bartlett and so many of the other physicians who I've interviewed and spoken to over the last many months have said the same thing time and again. Give people these natural, safe, or relatively very, very safe drugs even extremely early on so you can nip it in the butt and avoid the need for hospitalization. That's what we need to do more as a very advanced healthcare system. So keep all this in mind. There are some other things I'd like you to keep in mind, basic things, especially if you are new to the broadcast. And I speak this way even to those you know who are watching me all the time. I ask you, please, 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 share this show with someone who's never heard this information before, because it's that valuable for them to think about these things. Let me throw out a few more things about coronavirus, this whole pandemic that has so many people afraid. The people who live anywhere from 0 years of age to 70 years old are at a very, very low risk of being hurt by this viral infection. It's just a statistical truth. The comorbidities, anybody with obesity, diabetes, hypertension, you've got liver issues, kidney failure, the list goes on and on. Cancer, if you're dealing with cancer, if you're immunocompromised in any way at all. Any of these people, depending on how many you're dealing with and how old you are, your risk goes way up if you get infected with a virus. So please understand, in context, who really needs to be concerned. A relatively healthy person that doesn't have these lists of comorbidities and is under 70 years old, the statistical risk of you dying from this is infinitesimal. It is so, so small. COVID cases, I've done a whole show on this, are unscientific. They're using a test that's inaccurate. The inventor of the test never said it was meant to diagnose disease. It's giving positives when there's negative, and it's giving negatives when there's positives. And the caseload is not even those that get directly tested only. But if you were associated with that person, in close proximity to that person who was confirmed with COVID-19, then you're considered a probable case, and that falls into the same bucket as those that were actually tested. So you're all considered cases, and we're testing more, and that is why you're seeing all these case numbers go up. For every one person tested positive, you're looking at probably around 15 other people not even tested who are considered part of the caseload. That's why I tell you, these cases that are going up and up are based on no scientific evidence at all. And in the deaths as well, as I've reported many times before, it's come out of the mouth of Dr. Birx, who's part of the Corona Task Force, the White House Corona Task Force. She said that if anybody died of other issues, heart disease, cancer, you name it, whatever else might have happened, a stroke, but they tested positive or even displayed symptoms, that those people would be listed as a COVID death. Are you kidding me? Somebody dies of a heart attack and you call it a COVID death? And this is the stuff that's going on today. So you have to wonder about even the reports of how many people are dying. We also know for a fact, as I close out this show, there's no doubt when you just listen to everything they say and their advice to the public. Dr. Fauci is 100% pro-vaccine. That is the only thing he's hanging his hat on as the key solution to this. Never once mentioning glutathione, vitamin C, vitamin D, how much Americans should take. Nothing like that. Just cover your face, stay at home if you can, stay away from people for sure, and wait. The vaccine is coming. Bill Gates, we know full well what his agenda is. How much money he's invested is not out of the goodness of his heart. He's already admitted he's made 20 times the money he's put in. 20 times, folks. The CDC, pro-vaccine, they buy $4 billion plus of vaccines every year. You expecting the CDC to tell you there's some reservations with shots on any level at all? It is completely a biased point of view. And what's wrong is this is a public health agency that people are under the false perception that they only focus on the public's well-being when they are completely slanted in their point of view. The World Health Organization, second largest donor, Bill and Melinda Gates Foundation. It's crazy. How would anyone in their right mind think that the World Health Organization would say anything other than the basic narrative that you hear being talked about all over the mainstream media? And all these public health officials, they all sound like parrots. They repeat the same thing over and over again. Cover your face, stay at home, wash your hands, and wait for a shot. That is our best chance for a solution so we can get herd immunity. Never once do they talk about any of the other perfectly safe, highly effective ways to beat a virus that gets a hold of you inside. The FDA, the United States Food and Drug Administration, completely against anti-natural remedies. This is their whole thing. You mention a natural remedy, they'll tell you, well, we really don't know. But are they really looking into anything? No. They just want to place doubt in your mind. And of course, they'll tout all the drugs and approve all of those that they possibly can. 2/3 of their budget comes from the pharmaceutical industry. But no, they wouldn't be slanted in any way, would they? The American Medical Association, completely anti-natural remedy. You talk to most conventionally trained doctors, unfortunately, who are not up on these topics, that haven't dedicated the time to study it on a personal level so that they can be a good professional out there. Their impression, by and large, I know I'm generalizing, but it's so accurate, so too many times. They'll roll their eyes. They'll give patients in front of them the impression, yeah, you could try that vitamin C or this mineral or whatever, but, just make sure you stay on your medications. They downplay the significance of natural remedies. And just because they're natural doesn't mean they're ineffective. Doesn't mean anything at all like that. What it really means is they don't know what they're talking about. Question your conventionally trained doctor next time. Give a couple questions. If they start getting agitated, that's going to give you a clue that they're probably not the best doctor for you. And of course, politicians and the media, they're just right in lockstep with each other, following exactly what the pharmaceutical industry wants them to put out. The pharmaceutical industry has a lot of money invested in most of the mainstream media outlets you see out there, all the ABCs, the CBS, the NBCs, the CNNs, all these networks. They run all their ads for drugs. So they're going to make sure that the pharmaceutical industry is happy with them. And it's the same thing with most politicians that take their money from the pharmaceutical industry. They're owned by Big Pharma. My question to you is very simple today. Let's hear it from you. Who do you think lies the most? Dr. Anthony Fauci, Bill Gates, or the Center for Disease Control, the CDC? Let's hear you sound off. And hey, just between you and me, if you really think it's somebody else and you want to mention it down in the comment section, go right ahead. Because the last I checked, we still have freedom of speech. Thank God. And I think it's more important than ever that all of us, if you're not comfortable getting in front of a camera, do an audio podcast. If you're not comfortable doing that and you're a good writer, write an article, start a blog. If you don't want to do any of that because you're uncomfortable, at the very least, talk to your family and friends. Share this show with them. Get the information out that you feel people need to hear. Don't be afraid. Don't be shy. More people need to hear this kind of info so that they can make up their own mind. Make an informed decision about your health care. That's what I'm for more than anything else. Okay, so that's it for today. Just as a reminder, our show, the Natural Health 365 live broadcast, is every single day, Monday to Friday at 12 noon Eastern Time. We make another brand new show for you. This show is mainly focused on one thing and one thing only: improving your immune system function, getting that stronger so that it can protect your health. That's it for today. I hope you enjoyed this show, and I really look forward to talking to you again soon. Take care, everybody. All right, Instagram. Made it right